And PhraseExpander has really allowed us to very easily import things that we find ourselves saying to patients frequently. And that has been a tremendous time saver for us. My name is Jaime Saal. I'm the Executive Director of the Rochester Center for Behavioral Medicine in Rochester Hills, Michigan, and I'm responsible for running the day-to-day operations of our outpatient behavioral health practice. Our EMR system wouldn't allow us to check all that apply. It wouldn't allow us to pull in common phrases. So adding in PhraseExpander allowed us to streamline a lot of the things that our EHR system wouldn't allow us to do. Secondly, it seemed that we were retyping the same phrases over and over again, or having to copy and paste them from a different document. We want our providers to be able to spend as much time and energy on patient care as they can, and we try to decrease the administrative burdens associated with documentation. I think our providers were finding themselves quite frustrated having to type the same things over and over again, or not be able to easily access phrases that they were using all the time. Sometimes our practitioners can be a little bit resistant to change. They get in a rut, and even if what they're doing is not the most streamlined approach, they can be a little bit reticent to trying something new. So we were concerned about introducing new technology, but we found that the implementation was very successful. I think the learning curve was pretty quick. I think most clinicians were able to implement the new technology within a couple of weeks of learning it and really start meaningfully using it, certainly within 2 or 3 weeks of adoption. We found that the YouTube videos that PhraseExpander has posted were very helpful. Also, the company itself has been very, very responsive. If we've had any questions about creating templates, sharing templates, how to use the system, PhraseExpander has just been incredibly responsive, which has been very comforting to us. In my role as executive director, I routinely review the notes of our prescribers and providers in general, just to make sure that we're producing quality notes and that we're meeting all requirements. And the notes that I've seen since adopting PhraseExpander have just been an incredible advance from our pre-PhraseExpander notes. They are more thorough. There is just a lot more solid documentation, and it seems like our prescribers are really using the system to its fullest. I think that PhraseExpander has allowed improved quality of life for our providers. It has decreased a lot of the tediousness of documentation and streamlined the documentation process for them, which I think makes their days go a little bit better and smoother. I also think that the notes themselves are much better. It's mostly our prescribing staff using it right now, and we have 15 prescribers. So I would say it's possible that each prescriber is saving, maybe they're saving 45 minutes of time every day, times 15 prescribers. So that's real time saved. It seems like there's definite relief that our prescribers now have some documentation solutions that are making their lives much easier. And decreased frustration, certainly. I think documentation is much less of a chore, which is nice because they're able to focus their energy where they want to focus their energy, which is their patients. We would definitely recommend PhraseExpander. We think it's been a tremendous time and energy savings for our staff, and we find the company to be responsive and progressive and helpful, and we feel like it's a true partnership that we're in with PhraseExpander, which is very meaningful to us.